As we understand that the only nurse in the town quit a few months ago, and residents now have no access to medical staff. Let's get the very latest on the ground and bring in SABC news reporter Reginald Witbooi. Reginald, a very good afternoon to you. So you are fully kitted out in that town. Explain to the viewers why, what's going on there?
A very good afternoon to you, Blaine, and also to the viewers. I was supposed to do this live crossing at 11 o'clock, but the gravel road, which is about 50 kilometers from Pofadder, was so bad. So this is the only reason why we are doing this live crossing now. So we are here in Onseepkans, where people are saying that there has been an outbreak of the coronavirus pandemic in this area. And also, one of the schools had to close 330 learners at that school, now isolating because of some learners testing positive for the coronavirus. But before we get into that, the latest numbers for the Northern Cape is the total active cases as of yesterday was 7,100 in this province alone, with 1,899 people already lost their lives due to this pandemic. And I want my colleagues to put on the image of the Council of Scientific and Industrial Research that showed that the numbers of the Northern Cape actually increased, and from the second wave it actually went straight into the third wave, which is very concerning for the province. And at times we are trying to get hold of the Department of Health for comment. They were supposed to give us comment today on this very specific story, telling us that the MEC of Health in this province, Maruping Lekwene, he had to rush to an urgent meeting which President Cyril Ramaphosa called on the National Executive Committee of the ANC. So whether the lives of people in the province is important, we don't know. But I'm going to speak to one of the residents here, and she's also on the SGB of the schools in this area, and her name is Ria. Ria, a very good afternoon to you. We are here in Onseepkans. What is the state of primary health care? We know that the only nurse quit a few months ago. Why is that?
Good day. All I can say now is that the current sister that was here, she resigned, actually went on early retirement in April. And then since April, we've been struggling with the Department of Health. There's no healthcare facility. People that are actually being sick cannot be assisted because they need to go to Pofadder, which is also 50 kilometers, and they have to actually now pay for their own transport because the ambulance is merely never available. When you're calling the ambulance, they need to call the control room in Springbok, and then they need to give some sort of instructions through to Pofadder in order for our people to be assisted in Onseepkans. So by the time when the ambulance are here, people are already dead or people are already very sick and they cannot be assisted. That's the one thing. The other thing with regards to COVID is that I'm also part of the NPO in Onseepkans, and we at the NPO, we had 7 cases, 6 adults and 1 child, one of the workers. And unfortunately, one of our workers passed away, which is very sad. And due to the fact that that one child has tested positive, I took the initiative to ask the Department of Health, actually sent them an email and asking for mass testing in Onseepkans. So eventually it was approved, and 330 kids were tested, and 330 kids are currently now in quarantine because of the fact that the Department of Health, it's a requirement that you need to quarantine for 10 days, and that's the reason why the school is closed. And I'm not quite sure whether there's some sort of miscommunication between the SGP and our circuit manager, because the last time I spoke to him is that the requirement is that the children need to quarantine, but unfortunately there's nothing in writing from the Department of Education, and the doctor also instructed that the children needs to be in quarantine. Except for the adults in Onseepkans, they also have mass testing, and children that were tested positive, the amount was 8 kids and 2 teachers. And some of us are still awaiting our results. And for our adult people in Onseepkans, there was already 7, 8 or even 10 that I know of that tested positive. And unfortunately, we cannot mention names. But this is how serious the problem in Onseepkans is. And unfortunately, we doesn't have any assistance. And I'm blatantly saying it, any assistance from the Department of Health to take care of our people here in Onseepkans. We are sitting, we don't know when you are getting tested, we don't know when people are getting vaccine because the information are just getting lost along the way. And we cannot blame the one person and we cannot blame the other person. All of us need to take responsibility to actually save Onseepkans, but we cannot do it because of the fact that the Department of Health is nowhere to be seen. There was also complaints, there were also formal petitions that were sent to the Department of Health. And the people that can comment, unfortunately, is not here now at the scene. But nothing came out of that petition list. And we just heard rumors that we're going to get a sister on the 1st of September. But why can't that sister actually be appointed from the time that Sister Mayavi left and when she actually went on early retirement? And unfortunately, we are at that stage now that people in Onseepkans doesn't even care about COVID anymore because they've been forgotten. People doesn't care. They actually just decided, no, it's a little flu, it's a little gripe, and then we're just going the normal way. And unfortunately, that's a sad reality in Onseepkans.
You raised a number of issues on this COVID-19 pandemic in this area, but something that actually stands out is that you mentioned the fact that people actually forgot about COVID-19 and take precautionary measures. When we came into town, we saw a number of people not wearing masks. And have you raised these issues specifically on the nurse that quit the job with the Department of Health? Because you are also saying you are not getting anything from the Department of Health in this province.
You know, there were so many complaints being sent through to the Department of Health without any response. And there was a meeting in Pofadder where the MEC of Health and the MEC of Education attended. Unfortunately, it was some sort of political meeting, but some of our leaders actually went to Mr. Maruping and asked him for some sort of clarity, and the only answer that I got is like, the sister will start at the 1st of September. Now, my question is that if it's actually being mentioned just along the way, why can't it be made professional? Why can't it make public so that we can know exactly what is happening with our health facility? Here in Onseepkans is 2 clinics. You can see over there, there's a blue clinic that are actually standing there for more than 10 years now. It's a white elephant. The one in the mission are being used just for, I cannot even say emergency duties, but for chronic medicines. And even if you are a chronic patient, you need to get authorization from Pofadder, from Sister Paddy, in order to get your medicine. And personally, I had to ask for people. Actually, people came to me and asked, Ria, will you please be so kind to bring my medicine from Pofadder? And at one time, I had to actually brought 7, 8 packets of medicine for our chronic people here in Onseepkans.
Thank you so much. Well, Blaine, quite devastating situation here in Onseepkans. So you can only imagine driving 50 kilometers just for primary health care. No nurse in this area because she quit the job a few months ago. Department of Health coming from that residence, they've raised it numerous times. Nothing is being done, and also some people not even wearing masks in this area. Also, I can only imagine when people have to drive to Pofadder on that terrible gravel road that we were on when we came here. What if someone fell sick during the night? It's disastrous. And you know that the Constitution actually states that primary health care is a basic need. But we will try and speak to the Department of Health in this province. Also, I got comment from the Department of Education yesterday asking them about the learners testing positive and also the schools being closed. They said that both schools are open. So, like Ria said, maybe there's a form of miscommunication. But we are going to speak to other residents also in this area, and we are going to package a comprehensive story for our later news bulletins.
Reginald, thank you very much indeed for your reporting. I know there's a feedback coming to you. I know that can be distracting, so we apologize for that. But I just want to get a sense. So the lady said that the only nurse that they had took, I think she said early retirement, so it leaves them in a bit of a bad situation. But from the residents that you have been speaking to, what's their approach or, to vaccines? Are they for it? Are they willing to get vaccinated?
Speaking about the vaccination, Blaine, I asked Ria also earlier on whether the Department of Health came out to do vaccinations, and she actually admitted that the Department of Health came out to do the vaccinations, so they are still busy with that process. But the concern is that they don't have a nurse in Onseepkans to take care of the primary health site in Onseepkans, and they need to travel 50 kilometers. But as I speak to you now, I can even see children walking without masks in this area, which is quite concerning because really it needs to start at home. So I also think that education needs to be given to children as well, as to take also the precautionary measures. And we know that we need to mask up, we need to sanitize or wash our hands for at least 20 seconds, also keep the social distancing. But yeah, it's a different situation, Blaine.
All right, it is indeed a developing situation. Come back to us when you get response from the department. We'll get you on air, get the viewers the very latest. Reginald Witbooi there, live for us in the Northern Cape. Thank you very much indeed. Right, over 5,000 people were